Hello everyone, welcome back to Illum Biology. Let's move ahead with our next topic, and today we are going to discuss about the diagnosis of tumors or cancers. See, first of all, let's see what is diagnosis. See, detection or identification of any disease is called as diagnosis. So medically, identification and detection is called as diagnosis. Now there are certain ways by which cancers can be diagnosed, and today we would be having a discussion on this. Biopsy or histopathological evaluation, in which there are certain different kinds of biopsies like FNAC, fine needle aspiration cytology, then Pap Smear, certain imaging techniques like radiographs, CT scans, MRIs, blood tests, bone marrow tests, tumor markers, and molecular diagnostic tests. So let's discuss them one by one. The first one is biopsy or histopathological evaluation. See, if I split the word HPE, that means histo means tissue, pathological is pathology, that means a disease, and to evaluate, that means evaluation of a diseased tissue is called as biopsy. In this, what we do, first of all, the site which is having the suspected lesion, on that site we examine the site, and from that site we just remove a piece of tissue. That is now called as the tissue specimen, which is collected from the suspected site, and now this is then sent to a pathological lab wherein it is seen and examined, analyzed under a microscope, and a slide is prepared. As we all know, the cells in tumor and the cells of normal cells, the cells in normal tissue, they vary in certain microscopic features. So by looking at those microscopic features, we can easily rule out that which cells are normal cells and which cells are cancerous cells. So that is called as biopsy or histopathological evaluation. It is most valuable diagnostic tool which helps us to arrive at an accurate diagnosis. In this, the specimen which is collected is then first cut into a very thin section and then stained and then is seen under the microscope. Now biopsies are of different kinds, and the first one is FNAC, fine needle aspiration cytology. Fine needle, that means a very thin needle. Aspiration means to draw something. So by using the needle, a very fine needle, we draw tissue from the suspected site, and if any fluid is present there, that is also drawn along with that, and then the tissue and the fluid is sent for the microscopic examination. Like in this picture, there is a small lump in the breast of this female patient, and via a fine needle it is aspirated and is sent for microscopic examination. And FNAC plays a very important role in the suspected lesions of breast. Other than breast, it is very helpful in ruling out the tumors of thyroid gland. So this is what is FNAC means. Next is Pap Smear or Pap test. See, in this we look for the cells which are shed by the normal tissue into the lumen of any organ. For the best example is cervix. Now what is cervix? Cervix is a narrow canal which is present between vagina and uterus. Now in that narrow canal, the cells of the epithelium of the cervix are shed off. We just collect those cells and send them for microscopic examination. These Pap smear or Pap test is particularly used for screening tests. Now what are screening tests? Screening tests are done for early detection of any disease. Such patients come to us only just to rule out whether she is having some problem or not. Such patients are always asymptomatic. They will not show any symptom related to that particular cervical cancer, but just for the early detection, screening tests are done. It has got a very important role in cervical cancer. This is the procedure in which an instrument is introduced till cervix. See, this is uterus part, this is the cervix part between uterus and vagina. This instrument is then introduced till cervix, and then the cells are collected from that particular site, and then they are sent for microscopic examination. So Pap smear has got a very important role in screening of cervical cancers. Remember, as early the diagnosis is done, earliest the diagnosis is done, the better would be the outcome of the any procedure or any treatment that is done for that particular disease. So an early diagnosis is a very important thing. Now I'll talk about imaging techniques in which we produce certain images. It is used for internal organs to look out for the internal organs, and the first one is radiographs. What are radiographs? In common language we call them as the x-rays. Now x-ray image of any tissue is called as a radiograph, and this is very important for the case for the hard tissues. Soft tissues don't give a good picture in radiographs, so it is mostly used for hard tissues like bone or a tooth, and a simple radiograph would give us a two-dimensional view. As you can see in this figure, in this radiograph, you can clearly make out that there is a certain abnormality with this bone. In this figure you can rule out that normally a bone appears whitish in a radiograph, but in this case, in these cases, you can see some blackening of the bone of the picture, not bone but the picture, that clearly rules out that there is a certain pathology associated with the bone. Such radiographs of the complete mouth is called as an OPG, and in this OPG it is very clear that the lower third molar has not erupted completely, and there is a certain pathology associated with this lower third molar. That's how x-rays or the radiographs are very useful. Now what is a mammograph? Mammograph is a breast radiograph. A radiograph when taken for breast is called as mammograph. Mammo is a prefix used for breast, and this is done in the cases of breast tumors. Next is CAT scans. In common language it is called as a CT scan. The full name is CAT scan, computerized axial tomography. Now even in CAT scans we use x-rays and produce images. This is a CAT scan machine. Now what is the difference between a CAT scan and a normal radiograph? Let's say this is a bone. This is a bone. Now if I take a simple picture of this bone or a simple radiograph of this bone, then I can clearly see this surface and this height of this bone. But in a CT scan produces three-dimensional image of any tissue, and plus each and every section is visible in CT scan. In CT scans we produce multiple images of this bone in different sections. You can take these sections in different planes and in this section in different planes. So this is the advantage of CT scan over normal radiographs. As you can see, multiple images of a particular tissues in different planes and in different sections, so it always provides a three-dimensional view. Now the latest techniques enables us to produce a very good three-dimensional image. As you can see in this picture, this is a three-dimensional view of the entire skull, and in this entire skull you can clearly make out the hollowness in the mandible portion, the left mandible portion, which indicates a pathology associated with the mandible. Next is MRI scan, magnetic resonance imaging. As the name suggests, it uses strong magnetic field for producing images. This is a machine of MRI, and the biggest advantage of MRI is that no X-rays are used in this. We very well know, we studied in the last video in the carcinogens, that X-ray is itself a carcinogen and can produce cancers. So X-rays, using of X-rays for imaging is a bit harmful, and that's why MRIs are better than CT scans, because MRIs don't use X-rays. But MRIs are good only for soft tissues and not for hard tissue. So whenever you need to examine any hard tissue like a bone or a tooth, CT scans are a better option than MRI scans. So just remember one thing, MRI scans are used for soft tissues and CAT scans are used for hard tissues. You can see multiple MRI images in this picture and in this the other picture. The next is blood test or bone marrow test. See, if I simply withdraw blood from a patient and send to pathological lab to check out the number of blood cells, then if the WBCs are in the range of more than 1 lakh, that clearly indicates that the patient is suffering from leukemia. Now because blood cells are born in bone marrow, so bone marrow tests would also give us a picture of leukemia. Other than that, in blood we can look out for the antibodies against some cancer specific antigens. If those antibodies are present in the patient, that means those cancer antigens are also present, so that can also help in detection of the cancers. Next is tumor markers. Now what are tumor markers? Tumor markers are some substances, especially proteins. They are mostly proteins which are released by normal cells. Listen to this carefully. Tumor markers are released by normal cells, but these substances are released in a huge amount by cancer cells. Normal cells would release them in a very small quantity, but cancer cells release them in a very huge quantity. So the presence of a huge quantity of tumor markers in blood would indicate presence of certain tumors. And we will discuss about two very important tumor markers. The first one is alpha fetoprotein, and its high concentration in blood indicates the presence of hepatocellular carcinoma. But I said earlier, tumor markers are also produced by normal cells, and there are certain non-neoplastic conditions. Non-neoplastic conditions means other than tumor cases, its concentration is also increased in cases of hepatitis, liver cirrhosis, and even in pregnancy you can see an increased AFP in blood. Next is carcinoembryonic antigen. This is also a tumor marker, and this indicates the cancers of gastrointestinal tract, pancreas and breast, and this is also increased in non-neoplastic conditions. The last one is molecular diagnostic techniques. This is very important, as NCERT has mentioned it in a complete paragraph. Now in molecular diagnostic techniques, we focus on the genetic molecule, that is DNA and RNA. So we extract the DNA from a cell and analyze it. And what we analyze in DNA? About genes. We have very well discussed about certain genes that are having a role in cancer development. So we analyze those genes. Now which techniques are used in molecular diagnosis? The techniques used, first is DNA analysis by Southern blotting, RNA analysis by northern blotting, and polymerase chain reactions. We discussed about them in our previous videos. This is a picture of Southern blot analysis which is also used in this. And now what is the biggest advantage of using molecular diagnostic technique is whenever an individual is giving a history of cancer in its family, then there are chances that this individual has got genetic susceptibility to that particular cancer. So we just extract the DNA from his cell and we look out for those genes that can play a role in the genetics of cancer. Now if that particular individual has got those genes analyzed and they give a positive picture, then there are chances that the person might get infected, might get that particular cancer even with the exposure of very small amount of that particular carcinogen. For example, if the patient is having a history of, his family is having a history of lung cancer, then the patient after taking molecular diagnostic test should stay away from tobacco, because even tobacco in a certain amount can also induce lung cancer in this, because there is genetic susceptibility in that particular individual. So that's how molecular diagnostic techniques are very helpful in these conditions. So thanks a lot for watching us. In the next video we would be having a good discussion on the treatment of cancer. Stay connected with us and keep focus on your concepts.